Hello, I am Dr. Vinita Bendare, Director of Dyumna Women's Clinic. We are meeting today in the first episode of the series where we will be understanding PCOS. PCOS, as we all know, is a great challenge which is observed worldwide. So in this series, basically we will be understanding PCOS from various angles. What is PCOS? What are the reasons? What causes it? Can it be prevented? What are the measures that need to be taken to prevent PCOS? What is the age group in which PCOS can be seen? Can PCOS affect girls of younger age? Can PCOS affect ladies of menopausal age? And what are its possible complications? What are the physical and mental symptoms that PCOS causes? What are the systems, organs that are affected by PCOS? What does Ayurveda have to say about PCOS, and what is the care that Ayurveda can provide for PCOS? So in today's first episode, we will understand what is PCOS. So PCOS, as the name suggests, is polycystic ovarian syndrome. So from this, we come to understand that it has something to do with the ovaries. The change that PCOS causes in the ovaries, to understand that, it is important, or it will be helpful to understand the natural or normal functioning of the ovaries. When a girl is born, she is born with a pool of ovums or eggs in her ovaries. When she attains menarche around 12th year of her age, some changes start to happen in these eggs. The structure of ovum is such that this egg or ovum is contained in a particular structure which is known as follicle. So when a girl attains menarche, the changes that start to happen is, say, around 4 to 5 follicles start to mature, and one of them attains complete maturity around about 12th to 14th day of a menstrual cycle. It ruptures and the ovum is released. If it comes in contact with a sperm, that is a male egg, there is a possibility of conception. If not, after about 2 weeks, her next menstrual cycle starts or begins. So this is a natural process which continues. In PCOS, what happens is, we have seen that about 4 to 5 follicles begin to mature. Here in this case, instead of 4 to 5, about 8 to 10 or sometimes even 12 follicles begin to mature, and none of them matures completely. The egg is not released, ovulation does not occur. And as ovulation does not occur, the follicles that have begun to mature but do not mature completely, they remain surrounding the ovary in the periphery, and that structure appears to be like cysts, and poly means many. Over a period when this process continues, the structure of the ovaries appears to be surrounded like many cysts, and hence it is termed as polycystic ovaries. Also, we have seen that when ovulation occurs, after about 2 weeks, the next menstrual cycle begins. Here, since ovulation is not occurring, the next menstrual cycle also gets delayed. And that is why one of the prime symptoms of PCOS, that is irregular menses, is created. So here we have seen that the function of ovaries gets disrupted. But is it limited only to the disruption of ovaries? The answer is no. PCOS affects various systems and organs in the body, and hence various physical and mental symptoms are created. How and what actually happens, we will be addressing in our further episodes. Till then, bye and take care.